All right. Thank you for that introduction, and thank you all for welcoming me here at St. Ambrose today. Now take a second to look to the person to your left and the person to your right. Now what if I told you that one of you three will develop type 2 diabetes at some point in your life? Or that this person will have a great risk for developing heart disease, having a stroke, going blind, needing a limb amputated, or even dying at an early age. Unfortunately, these are many of the outcomes that people with diabetes are challenged with on a regular basis. Although despite these serious risks that come along with type 2 diabetes, the growth of this disease continues to this day and is becoming more and more popular. This disease is extremely common, and based on the class survey, most of you all know someone with type 2 diabetes. The frightening part, though, is not all the people that we know that are diabetic, but the ones that we don't. And according to the American Diabetes Association, one out of every 4 people with diabetes don't even know that they have it. Diabetes is a dangerous and all too common disease, so for you to understand the importance of avoiding this disease, I'll explain 3 effective ways to prevent the onset of type 2 diabetes, which include managing weight, following a healthy diet, and exercise. But first, let's start with the background. Diabetes is a disease of insulin resistance caused by chronic high levels of blood sugar or blood glucose. Since the body needs insulin to absorb glucose, it tries to release large amounts of insulin to use the high levels of glucose. Pancreas cells begin to shut down after they're forced to overload themselves to release large amounts of insulin. Insulin injections then become necessary to be administered daily to use the glucose that's in the blood. And if there isn't enough insulin in the blood, the glucose cells in the blood get stored as fat and just stay trapped there. The pressure from the fat decreases circulation, which limits the blood supply to the organs, and including the kidneys, which can cause a need for dialysis to clean the blood. Lack of circulation to the blood vessels in the eyes, which results in blindness, and then poor circulation to the limbs, which can lead to amputation. And the increased pressure on the nerves from the fat too limit the sensitivity of the limbs, so many people don't know that they even have a poor blood supply or feel anything. Because of the many complications of this disease, it can be deadly. And according to the Center for Disease Control, diabetes is the 7th highest leading cause of death in the U.S. It may even be higher because of the underrepresented values from people dying with strokes or heart disease. It's not always listed as diabetes. And even though this disease can progress quickly with many negative outcomes, Dr. Mark Hyman, a family physician and New York Times bestselling author, stated these conditions are also 100% preventable and reversible. Which brings us to the first main point. Weight management. Maintaining a proper weight is key and can be ensured by measuring your BMI values, which is body mass index, which measures the fat on your body. A healthy BMI value is 18.5 to 25, and an overweight value is 25 to 30, and then obese is considered 30 or above. Losing weight drastically helps, and even losing weight drastically helps for diabetes, and even losing 2.2 pounds will reduce the progression of type 2 diabetes by 16%. The effects of losing weight are evident when looking at patients that have overcome diabetes. Larry Gershon, a type 2 diabetic patient who weighed 200 pounds when he was diagnosed, lost 45 pounds in 3 months. Jim Kennedy, a patient who weighed 265 pounds when he was diagnosed, lost 60 pounds within 5 months. And Jonathan Lugg of Bethesda lost 40 pounds over 3 months. Now, all of these patients are within healthy limits and free of diabetes due to their lifestyle changes. Along with maintaining and following a healthy diet, making sure your diet has proper contribution is a key factor and should be monitored. The amounts of added sugar in your diet should be limited by avoiding white breads, canned fruits, desserts, and excess candy. This helps avoid sugar spikes, which eliminate the need for spikes of insulin, and it keeps the levels at an average level. And keeping fats in control is also important to reducing your BMI. And although 25% of your diet should be from fats, you should try to get them from healthier options like fish, avocados, or nuts. So you're getting the healthier, unsaturated fats, and while avoiding the fats from animal products like beef or pork that are highly saturated fats and just get it stored right away in the body. Eating more fruits, vegetables, and whole grains also helps because this adds fiber to your diet and helps clean your digestive system out. So there's less excess nutrients staying in your body at any time. Fruits are also a good substitute if you're craving sugar because you get the health benefits as well as the sugar satisfaction. Controlling alcohol is also important because alcohol has more calories per gram than any food does. So limiting your amount is important, even if it means cutting back your trips to Rookies to maybe once or twice a week. Is a very important factor to control for weight management. Portion control is also key, and you should limit the amounts that you put on your plate at any given time and eat slower so your body has time to process it, realize that it's full, and you're satisfied quicker. While you eat less, your hunger gets satisfied, your stomach shrinks to the level of food that you actually need. And so for your next meals, you won't eat in excess, and it stays at a pretty limited rate. And then lastly, one of the biggest those were the healthy diet. And then lastly is controlling exercise with resistance training and aerobic training. I know as well as all of you that after spending hours in the library doing homework and studying for exams, that going back to your room and binge watching Netflix sounds much more appealing than dragging yourself over to Lululemon to get a workout in. But exercise is extremely important. Resistance exercise helps increase insulin sensitivity because while you're working out, your muscles need glucose, and they need it so quickly that it bypasses the effects of insulin. So insulin isn't required, your muscles take it up right away, and then this effect follows hours after working out. And so when your muscles aren't taking in the glucose and you do need insulin, your body becomes more sensitive to it when it's present, and you need less amounts to take in the same amount of glucose. Increasing the muscle size during resistance exercise also causes a greater need for glucose absorption because more muscles need more glucose to provide the energy. My cousin Marty, who developed type 2 diabetes 4 years ago, started exercising regularly for 3 times a week. Now he only needs to take a third of his normal insulin injections when he needs it. Along with resistance training, aerobic training is just as important. Running increases the circulation so blood can flow to all the organs. This prevents a lack of blood supply resulting in amputations or kidney failure, and keeps the circulation going at a normal rate. And also through both types of exercise, fat is used as energy, so this helps reduce the BMI, and there's less pressure from the fat, resulting in better overall healthiness. Today I've talked about 3 ways to prevent type 2 diabetes, which included managing weight, following a healthy diet, and exercising. Hopefully you all see the need to use these lifestyle changes to avoid any severe consequences that come along with diabetes. So avoid being blindsided by this disease and start working to attack it before it attacks you.